dengan slide beliau, dan tentunya topiknya ini cukup hangat ya, bagaimana AI ini bisa bermanfaat atau dimanfaatkan untuk berbagai hal. Dan sebelumnya saya akan mempersilahkan beliau Prof. Laksono yang cukup semangat begitu ya, bagaimana memberikan hal-hal baru utamanya bagi mahasiswa. Tentunya ini membuat semangat beliau tidak putus begitu ya Prof. Laksono untuk bisa mengenalkan berbagai hal utamanya hari ini berkaitan dengan AI. Untuk itu kami persilahkan kepada Prof. Laksono untuk memberikan pengantar lebih dahulu kepada kita. Oh ya, saya juga ingin menyapa sebelumnya ya kepada rekan-rekan yang ada di online yang bisa bergabung bersama kami melalui Zoom. Dipersilahkan Prof. Laksono.
Assalamualaikum warahmatullahi wabarakatuh. Selamat siang dan salam sejahtera untuk kita semua. Om Swastiastu, Namo Buddhaya. Salam kebajikan. Okay, thank you very much. Yeah, I have to read his name, Professor Dr. Jens Geissler. That right? My pronunciation is slightly difficult because he's a German. Yeah, Germany. Kita orang Indonesia. It's different name, different pronunciations, and it is very interesting that he is a professor for uh, Gesundheit and Social Management. Nah, ini menarik ya. So, Gesundheit is health ya, health ya, kesehatan ya, and social management, paham ya, manajemen sosial. And he is not a medical doctor, not a public health, but he is a policy analyst, yeah, something like that, from the School of Social Policy. So it is very interesting, a mix of political sciences in health and also no as everyone interested, AI, artificial intelligence. Ya, oh, I speak in bahasa first ya. Ini menarik ya, kombinasi antara AI ya, artificial intelligence dengan social health insurance, dan ini merupakan inovasi yang menarik ya. Jadi kita di perguruan tinggi harus tahu nih, saya juga waktu dihubungi Bu Diah ini, apa sih? Saya juga bingung juga. AI, so I was confused what is the meaning of AI and social health insurance. Ya. Tapi setelah saya baca tadi malam papernya Prof. Jens, oh ini ya, jadi memang betul ya. So it is very relevant to our BPJS condition at the moment. Yes, we have to think is to have more efficient, more effective, and then also more equity of health insurance in Indonesia. And I think this is the right time for us to learn about what is the usefulness of AI in social health insurance. But also, Professor Jens, our policy is also not only introducing social health insurance, because when we look at the financial condition of Indonesia, of the tax income of our government, I think it's totally different with the Deutschland or the German tax system. We are very, very poor country, and our tax revenue is so low, very, very small compared to the West European countries. Okay, so the tax ratio in our country is only 10%. I think in Germany it's around 12, no, it's 20, 25. Yes, 25. Yes, it's a huge, much bigger GDP. So that means the power of spending in the German government is much more compared to the Indonesians' capacity. So that's why the government is also introducing the private health insurance. Yeah, for complementing, and especially for the middle up the citizens. I think they have to buy the private health insurance by their own money, not relying on government subsidy. So that's the point. But I think the AI can be used for the social health insurance and also the private health insurance. Is that right? Maybe? Yeah, for the commercial health insurance as well. Yeah. Oke, tapi sekarang adalah kita masuk ke topik yang menarik ya, tentang bagaimana AI dalam social health insurance. Oke, mari kita tepuk tangan dulu untuk Pak Jens. So thank you very much ya. I hope you can enjoy your discussion with the students, and I will follow through Zoom. Yeah, thank you very much. Yeah.
Thank you very much, Professor Laksono, for the invitation, for the opportunity to be here. Ibudia, shall I start? Okay. Maybe you can open the presentation. While the presentation is opening, I see all the notebooks here. Who of you uses facial recognition to log in? Can raise your hand. You just open the computer and the computer recognizes your face, right? Anybody else? I do the same. I'm a lazy person. Before, I just changed the computer maybe 2 years ago or 1 year ago. I had the recognition of the fingertip. The scan. Who's using the fingertip? Okay, so you're mainly fingertip. Ibu Dia just impressed me a lot because when we entered one of the buildings, I don't know which one it was, she just pressed her finger against a point on the door handle and the door opened like magic. Now, why am I saying that? Because that is artificial intelligence. Not of the very, very sophisticated kind. It's a little bit of the simple kind, but there are many, many different kinds of artificial intelligence. And that's one of the things which makes it a little bit complicated to talk about artificial intelligence, because people can mean very many different things when talking about artificial intelligence. So I want to make it more concrete what we understand by artificial intelligence and specifically how it can be used in the context of a social health insurance. I had the opportunity to give this presentation for staff of BPJS Kesehatan this week on Monday. So that's why we specifically talk about social health insurance. Maybe next slide. So to briefly introduce myself, as Professor Laksono said, by background of training, I'm political science plus management. And that is actually relevant for my way of talking about this topic. I am neither a medical doctor nor an IT person. I cannot program artificial intelligence. And I think it is very important. We need all perspectives when we talk about IT and artificial intelligence. We need the IT guys or girls who do the programming and who develop the systems. We need the medical doctors to provide the content, but we also need people who understand about management, who understand about policies, about political frameworks. So all these perspectives are relevant. So if you would have an IT person doing this lecture on the same topic, it would probably be very, very different, talking about the same things. I actually want to mention that I did a lot of work on development cooperation also in Asia, and that's where I met Ibu Dia. So Ibu Dia is actually, I consider her a very old friend because she participated in one of the courses which I did decades ago, and since then we've been in contact. So I worked in health insurances, and actually now 3 years ago, I founded my own company developing digital medical devices. But now let's go into the contents. Next slide, please. So here we have all kinds of different applications for artificial intelligence. And the point I'm making it, this is not the future. This is the present. This is all existing now. So we have medical imaging and diagnostics. So I will give you examples for that you can, for example, you can improve the quality of images. You can analyze medical images automatically using artificial intelligence. Patient monitoring and remote care. Maybe patient with diabetes who have automatic monitoring of the blood pressure, which is then analyzed, transmitted to the doctor via telemedicine to manage the condition. You have chatbots where you, who here uses Alexa or Siri? You know these systems where you talk with your computer, Siri, play my favorite. You're a tech person. You always have the newest technology, right? I see that. So you know what I'm talking about. Yeah, so you speak with the computer. In the health field, personalized mental health treatments using virtual reality. Virtual reality, where you have some kind of digital room or augmented reality, that is always artificial intelligence because you combine different kinds of pictures, for example. Prevention via automated screening programs. I will give you examples for that. Personalized medicine, genome analytics. So we can, like the first analytics of the human genome took huge powers of data. Now you can just order that online And companies will do that. And that's, again, artificial intelligence, this analysis. Automatic translation of text and speech. Honestly, I have not mastered that yet, but I heard from people traveling to other countries that when you don't speak the language, you use like tool, you speak into your app, and the app translates automatically. Like an automatic translation is always artificial intelligence. Or, you know, when you watch a movie, text generation. No, this is actually the audio. No, which one was I? It's both. When you watch a movie, and maybe the movie is in English, and you get subtitles in Bahasa, or we do it the same with German. And sometimes the subtitle is funny and makes mistakes, strange mistakes. Well, artificial intelligence. So this has not been programmed, this has not been typed, but an artificial intelligence is understanding the text, analyzing it, and then providing the subtitles. That is artificial intelligence. Risk analysis for premium calculation. This actually refers to what Professor Laksono was just talking about, because this is more in private health insurance. In a social health insurance, we don't do risk calculation for premiums, but you can do that in a private health insurance. Fraud detection, document types, will come to that. And you can just generate your text. Now, of course, I will not ask you if anybody here has ever cheated by writing a paper with ChatGPT, but you have used ChatGPT? Oh, I use ChatGPT almost every day. And this is still so new. And I think ChatGPT is very interesting because until then, and when was ChatGPT? 1.5 years ago, maybe? Around that time. And some of these technologies, like the medical imaging, has been around for, I don't know, maybe 10 years. So it's not so new. And so it was always very specialized, but with ChatGPT and the large language models and automatic generation of pictures, of videos, this has opened whole new perspectives of application. Click once, please. Click once more, because this is actually no coincidence. I've sorted this a little bit. All the ones on the top of the line is artificial intelligence in healthcare, using digital medical devices. So all of these things on the top is medical devices, which need to be safe. Otherwise, we might harm a patient. Click once more. On the bottom side, these are actually not medical devices. These are more for administration, like generating a text, generating a picture, or here, the text or a chat bot. That is not a medical device. So in my talk here, I will talk about both aspects, both the medical artificial intelligence in the medical devices, and we will start with that in a moment, and about those within a health insurance, and specifically a social health insurance. Next one. So again, from a non-technical perspective, we have to have some basic understanding. What is it about artificial intelligence? Ibu Dia, you will interrupt me when you want to translate. We need large data sets, large amounts of data. That's why for something like ChatGPT, they analyze, I don't know, maybe almost everything which is on the internet to analyze patterns in data. Or you do the same for the medical imaging, where you analyze whole sets of data maybe generated by a whole number of hospitals. And as a result, we need large computing powers. So they're building new data centers, they're building new plants for electricity because they actually need a lot of computing power. That is something we don't really see as a user. It is just there. It is something which happens on the technical level, on the background. More important for us from the application side is the quality of the data sets. Because if the quality of this data set is not good, the quality of the result will also not be good. Example, medical imaging. We will come to examples later, like for skin diagnostic, like dermatology. I will give you an example for analysis for skin cancer. Now, what data set here or data quality means, you have to have a picture plus the diagnosis. And the diagnosis has to be correct. So this picture is cancer or this picture is not cancer. It has to be, the diagnosis has to be correct. Otherwise, the conclusions which you draw from these pictures will also not be correct. And any discrimination which you have in the data will reflect in the results of the artificial intelligence. Here, the fourth point from above. Very often, data reflects discrimination in or imbalances in society. Now, just imagine that, and it doesn't even matter which way, more women or more men go to the doctor, or health-seeking behavior. So the health-seeking behavior is different. So the results of the diagnosis are more based on one population group. So then there will be a bias in the data. So this data, you always have to reflect in what way discrimination in your everyday life is conserved in the data. And then you do use that data for a new purpose, but the discrimination is still there. Keep that in mind. And then the next point, the third from below, when the data set changes, the output of the AI also changes. That is something very difficult for registration of these products. Like if we do, like we talked about medicines, the regulation for the medicines. So if you do the study for the medicine, you have one set of ingredients, it does not change, and it's always the same. And you produce the same way, so the medicine will always be the same. That is not the same with AI. You change the set of information in the AI learns and will give a different answer. You have to keep that in mind. AI provides the most likely answer to a question, assuming that this will be the right answer. So AI will not provide a diagnosis, but it will say, if I compare this new picture to all my old pictures with a likelihood of 80% or maybe 90%, this will be cancer, or it will not be cancer. So this is always, it's based on statistics. And this one, the last one, you all know from ChatGPT, generative AI, the large language models, the result depends a lot on the questions which you ask. Imprecise questions equals imprecise result. So be careful about cheating with ChatGPT. I think I will recognize because I'm more clever. I know the better answer. I know the better questions because you have to be really good at asking the right questions. So studying like what you do now is still very important, even with large language models, because you learn to ask the right questions. Next slide, please. Yes, please. You go back.
Rekan-rekan silahkan jika ada hal-hal yang ingin diklarifikasi mungkin sebelum jauh. Kita lihat di sini ternyata banyak ya karakteristik yang muncul di sini. Misalnya AI itu tentu dukungan terhadap data atau terbalik ya, data itu mendukung hal-hal yang tadi, misalnya kalau ChatGPT berarti kan dia punya banyak dulu ya masukan-masukan sehingga dia bisa menjawab dengan benar. Dan kalau datasetnya itu berubah, tentu jawabannya juga akan berubah ya dengan berubahnya komposisi atau data-data yang masuk. Ternyata juga banyak hal-hal lain yang sangat mempengaruhi dalam AI. Jadi menurut beberapa orang, so AI is solutions for all. I think that's a tricky question. How about that opinion? Is it AI solve?
No, AI is a tool. And so you always have to be very careful. First, you have to define what do you want to do? What is your purpose? And then you have to check if AI is the right solution. And that is what I will be talking about when we talk about business processes in health insurance, that AI is normally not the right solution, that we're talking about different IT systems. But for us as users, it is sometimes very difficult to see if something is artificial intelligence or not. So that's why I can say, okay, if this includes facial recognition, that's AI. If it includes 3D pictures which move like virtual reality. That's artificial intelligence. Recognition of pictures, artificial intelligence.
Jadi kita sebetulnya sudah bersentuhan ya dengan artificial intelligence, mulai dari tadi face recognition, kemudian memindai fingerprint misalnya, itu sudah satu aplikasi begitu ya yang sudah kita gunakan. Jadi tidak harus sesuatu yang rumit begitu ya, tetapi yang sehari-hari kita gunakan juga sebetulnya sudah familiar gitu ya dengan AI. Ada yang ingin didiskusikan sebelum kita jauh? Cukup? Tidak ada? Sambil jalan ya. Baik. Next.
Okay. Now, since I'm putting this topic into the context of social health insurance, we need one slide for some basic ideas which are relevant for social health insurance when we talk about artificial intelligence. The first one on the top here, based on laws and statute, not individual contracts. So you are doing BPJS Kesehatan for the whole population of Indonesia. That is based on laws, on rules, on statutes. And people have rights. And the purpose of a health insurance like BPJS Kesehatan is to implement rules, to apply a set of rules. That is actually very different from artificial intelligence. We'll come back to that. So they have to document their decisions. They have to write things down, document in files why they have decided, yes, you get this operation. No, you don't. Yes, we have received your premium, your premium payment, for example. I learned yesterday that there are inactive members of BPJS Kesehatan. So your status has been changed from active to inactive. All these are decisions which have to be documented because maybe somebody will go to the court and say, no, this is not correct, or you have to change it. So, and data protection is very important. We're talking about patient data, about insuree data. The next point, the objective is to ensure healthcare for the whole population. In a social health insurance system, we're talking about huge numbers of people. So the people, the management of BPJS Kesehatan, they always said, we are providing health insurance now for about 270 million people who pay premiums. Premiums are collected, claims are put in. So the number, and was it almost 2 million of healthcare visits per day? So the number of claims or of cases we're dealing with is just mind-boggling. So this has to be handled and it has to be accessible for everybody. That is the idea of a social health insurance. Now, also, we have something which we call purchaser-provider split. The health insurance does not provide the health services. It contracts the health services from healthcare providers. That is something very different. So the health insurance has to deal with thousands and thousands of healthcare providers, or the primary healthcare, the hospitals, the dental, you name it, you know that. So that's, again, a whole lot of data. And they probably cannot just say, we do a digital program ourselves, because it does not really fit this idea of purchaser-provider split. And they cannot really tell the providers, you have to use a certain digital tool. The last one, no personal calculation of risks and premiums, financial stability. Yeah, that's okay. So click once, because now we're actually continuing with this bottom part, focus on this here, on the side of the providers. And I will give some examples now of actual applications of artificial intelligence. No, I forgot one slide before. So what, no, it's okay. Go to the next. So what is actually the role of social health insurance in relation to artificial intelligence? Set quality standards. I talked about the bias, the discrimination in the data. So the health insurance has to make sure that this does not happen. So that maybe you could have a situation where you have gender inequality or social inequality in the data, and then maybe the result does not fit to some population groups. So set standards. The health insurance, that the second point, also has to pay for these innovations, because somebody has to put in the effort and the energy to create a new system. And so this has to be paid for, it has to be rewarded, otherwise there is no innovation. And so the health insurance has to think about, how do you do that? How do you create these payments? Also important, since this is for all the people in the country, people have to understand, not only you here in the room, but people who use healthcare services have to have a basic understanding about how technology, how artificial intelligence is used. We call that digital health literacy. So you know about health literacy in accessing health providers, in influencing health-seeking behavior, in understanding information. Now, this is just as relevant, maybe even more relevant, with digital information sources, where you don't know where they come from. You know, Dr. Google. So is Dr. Google right or is Dr. Google wrong? How do you read? How do you understand the information from Dr. Google? Who has used Dr. Google? You're all young and healthy. So you have to look at people like me who are a little bit older. And so maybe something hurts and you ask Dr. Google. So is that okay? Does it make sense? Well, probably not. So very important, the social health insurance has to, we talked a lot over the last 2 days about limited resources. There is not money for everything. So you have to set priorities. So what is the priority in using artificial intelligence? It could be digital screening for disease prevention. If you say we have a problem with certain diseases, which we could identify earlier, if we can do mass screenings with artificial intelligence, or it could be access to healthcare services. Then maybe we're talking about telemedicine, simple devices which can be used without a specialist. Or it could be treatment of chronic diseases, some things you can do for diabetes monitoring. And this is specific for each country, because of course, every country has a different profile of diseases. So there you have to make the right decisions to use the resources of the health insurance. Do you want?
Dari paparan Prof Jens sampai ke slide ini ternyata banyak sekali ya bisa digunakan AI, tetapi kembali bahwa di mana sebetulnya ini digunakan, karena tentu dalam bisnis proses itu ada tahapan-tahapan. Tadi disebutkan juga oleh Prof Jens bahwa di sistem kita, di Social Health Insurance atau Jaminan Kesehatan Nasional, dipisahkan antara pembayar dengan pemberi layanan. Tentu ini juga akan menyebabkan akan banyak sekali tugas-tugas dari masing-masing sebagai provider atau sebagai pembayar. Misalnya tadi kalau jumlah klaim per hari yang masuk saja sekitar 2 juta, bisa dibayangkan bagaimana ini melakukan verifikasi begitu ya, sehingga betul-betul secara finansial, sustainabilitas keuangan begitu ya dari sisi pembayar ini bisa terjamin ya, sehingga nanti tidak ada mungkin dampak-dampak dari tadi ya tidak berjalannya sistem verifikasi, bisa jadi juga tadi menimbulkan potensi-potensi fraud yang sekarang juga sedang cukup marak ya. Tentunya sistem support yang membantu manajemen baik itu dari sisi pembayar maupun dari pemberi layanan ini sangat-sangat dibutuhkan. Tetapi kembali karena sangat-sangat terbatasnya tadi ya resources atau sumber daya, jadi harus pilih-pilih juga ya prioritas di mana nih sebaiknya digunakan AI. Seperti yang pertama tadi, apakah yang terakhir ya, apakah memang digunakan nanti untuk screening proses begitu ya. Jadi kita lebih ke hulu gitu ya, mengetahui lebih baik secara dini begitu ya. Atau mau ditaruh di mana? Misalnya remote area. Remote area, so we have also challenges in distributing health workforce. For instance, in remote area. So maybe this is a solution, part of the, maybe not the solutions, but it will ease the difficulties. Ini akan mengurangi tantangan-tantangan dari kekurangan sumber daya manusia. Seperti tadi health ya, telemedicine. Tapi kembali, nanti kalau ada telemedicine terus sistem pembayarannya gimana ya? Nah ini juga kan perlu difikirkan juga sampai ke financingnya. So if we use like telemedicine, we have to also consider on how the payment system will be. So this is also our challenges now. We developed telemedicine, but not yet maybe set the way how we provide the payment system.
That is an important point. So
Yeah.
for every innovation, you have to decide how will you pay for that. You cannot just assume that people will provide a service for free. So for telemedicine, you have to decide, well, do you pay as much as for a normal consultation? Or maybe you pay a little bit less. You can set rules, but there have to be rules, and the rules at the end result in a payment to the person who has given the digital consultation.
Yeah, and also for chronic disease. Nah, untuk penyakit kronis ini juga tentu tantangan kita sangat besar ya, apalagi for chronic disease it would also consume in a long term way. So waktunya sangat panjang, tentu ini juga membutuhkan. So the other challenges is the from the patient side, because the compliance of the patients to deal with the treatment schedule, for instance, bagaimana pasien itu juga patuh begitu ya terhadap jadwal dari pengobatan, dan saya rasa ini juga satu tantangan. Apakah ini juga nanti bisa menjadi satu is there any system that could also like as reminder from the patient side to access to the healthcare?
Well, I can give an example for that. I don't have a slide on that because it is actually not artificial intelligence. But my company, we have a system which has been developed by another IT company, but we are sort of supporting it, which is for people who get antibiotic treatment intravenously at home. So they are very sick. I think one example is actually tuberculosis. Is one example where we don't have much TB in Germany, but there are some treatments where people are very sick, but the only thing they need is antibiotics intravenously, maybe 3-4 times a day. And this application reminds them now, because it's a very strict schedule, you have to take it on certain times. So it sends them a message. You have to take your antibiotics, and if they don't take it, they get a reminder. You have not taken, or have you documented? And they can document their well-being. Are they doing okay? They can chat with the doctor. They can communicate. So compliance management is actually something which works quite well with digital tools.
Iya, seperti tantangan kita untuk TB mungkin ya, bagaimana mereka patuh. So we have also these challenges for TB program. So we already have a program on the pengawas minum obat. It's like caregiver. So they remind the patients on when and the frequency of they are taking the treatment. So, and when they have to see the doctor again for the to have a control or laboratory tests or something like that. So for especially for not only for communicable disease, tetapi juga untuk chronic disease ya, untuk penyakit-penyakit kronis. Any challenging questions or burning questions? Pertanyaan silahkan.
Okay, thank you very much. I'm Ika from Health Management Information System, and I want to ask how much data set is needed for predictive analytics to run well. I plan to create image recognition for food tracking for pre-diabetes screening, and can this food recognition data set be collected voluntary, or what is the best way to collect it? And does the Prof have any reference suggestion in develop image recognition? Thank you.
We'll actually come to image recognition on the next slide, so we can take up your question. Because this is actually one of the examples of image recognition. So you see here there's a smartphone, but it also has, for better image quality, a special device. But what you're asking for is, in a way, what is before that? Because before, you need a whole set of images, and for each image, you need the diagnosis. And here, in this case, it is very important, what is the qualification of the person who does the diagnosis? So it's the image quality, but so you need a dermatologist? Does it have to be a specialist? It cannot just be anybody. So you need a very high quality in the diagnosis. And the idea basically is that the larger the set, the better the quality of the prediction. And usually what you would do is, like I'm dealing with some examples of artificial intelligence, and what they normally do is they just look what is there, what images are already there, are already being taken, and they use existing images which have been generated and probably already have a diagnosis, but they will do a quality check, quality check on the image and a quality check on the diagnosis. So they will normally not start from zero with, you could also just say, okay, I take a lot of pictures and do the diagnosis. But since healthcare is already happening, people are already going to the dermatologist to have the skin checked. So I would use data from an existing health process, an established screening process, established diagnostic process, and use that data for training the artificial intelligence. And here, then after that has happened, this here is actually the second step, is you take a new picture, and the new picture is then analyzed, and here sort of the critical areas are visualized, and you get a result of this is most likely not cancer, or this is cancer, go to see a medical doctor right away. You should seek a dermatologist for further diagnosis and then actually for treatment. So, and I have to say, this image recognition is actually, this has been around for quite a while. So this is not new. The new ones are the large language models. So this recognition is more is very well established. But again, here, how about skin color? Like if you do all the images with Europeans, does it translate exactly into people maybe from Africa or from Indonesia? So maybe the skin color is different. How does the skin color influence the result of the artificial intelligence? So it might actually still make sense to develop systems for Indonesia because your physical features might be different. So this as one example. Next slide. And there is actually a lot of studies on this. So I will not go into details. The links to the studies are here. This here is actually, I wanted to show you this article from 2023, because here it has actually been checked on a large population group. So a Dutch social health insurance offered this to, you see, 2.2 million adults. And so it was almost 20,000 users who used that, almost 60 who didn't, and they compared the results of the screening, because here, the more you screen, the better your chances of identifying the cancers early. So, and maybe if you, and the good thing is, normally you need a dermatologist for the diagnosis. So you need a medical specialist. So the number of medical specialists will limit the amount of screenings you can do. Now, with artificial intelligence, you can do much, much more. You can increase the frequency, and you can actually take a picture of the same skin part again and again and see how it changes. Next. Next slide, please. So this is another example, and this is actual virtual artificial intelligence, because here you see this is a virtual AI artificial virtual reality glasses. And this creating a digital world is always an example of artificial intelligence. And here, this is used for mental disorders, phobias, post-traumatic stress disorders. So you can provide scenarios. You can put people into scenarios which maybe they find disturbing, but you can regulate it. So I was involved in a project where they want to do this for mental health for children. And so maybe you can start a training program with very, very simple exercises, which are not threatening. And then if the child has learned, you go to a next level. It's like a computer game. Like we talk about serious games, and the serious game is still like a game. It's playful, but it has a serious content, as in, for example, dealing with the topic was feeling uncomfortable at school, loneliness at school, feeling excluded, feeling maybe not good. Huh? So how do you deal with that? And here, this study was done for post-traumatic stress disorders, actually also for soldiers who go to the war, or people who suffer from war can be treated with this kind of treatment. Next slide. This is again artificial intelligence based on images. In this case, it is eyes, and it's probably a little bit difficult to see from the back. Here, the good thing again is you don't need the medical specialist. So talking about reaching people in remote areas, you can put a quite simple hardware, a simple device into an optician's shop or into a primary healthcare center, and then they only take the picture and the artificial intelligence will do the diagnosis. And so here, diabetic retinopathy, so this is for people who suffer from diabetes, where you normally have to go to regular screenings from an ophthalmologist. Now, what do you do if there is no ophthalmologist? So here you can increase the access. Okay, maybe next slide. So any remarks on what I just said, or shall I just continue? Okay, now, so that was the first half of my presentation about artificial intelligence in healthcare services. So some examples of how you can use actual artificial intelligence in diagnosis and treatment. Now we come to the second half, which looks more into a health insurance and the internal side and onto the management side of a health insurance. Next slide, please. Now here, just imagine, we have those, it just stuck in my mind, the inactive members of BPJS Kesehatan. Maybe you realize that you're inactive and now you call BPJS. You said something about 40 million inactive members? I just want to remind you, we're talking about huge numbers. Now just imagine they call, but the one who takes the call is not a person, but a chatbot, like an automatic system. So we need language recognition, speech recognition. So the chatbot has to analyze what does the person want, and has to also has to document the question, because we have to create a record and identify, this is about, I am inactive member, I want to change something, I want to make a repayment maybe, or what do I have to do? What is the procedure? Or maybe you need a form, you want to request a paper. So maybe the chatbot just answers the question fully. So question solved, case closed. Or I'm just imagining, maybe when you're inactive, there's a form. There's some kind of form where you provide information. So this could either be through a digital system, like an app, or it could be a paper form which is sent out. So maybe there could be an automatic process where the IT system of BPJS Kesehatan is triggered by the chatbot, and the system sends out maybe a letter or an access to an application. And only the rest here, which are complicated, maybe, I don't know, any special case, maybe somebody has been in another country or has many children or whatever the case may be. So these difficult cases are forwarded to the actual staff members, who then ideally, again, activate an automatic process, so they don't have to do anything manually, or they actually do it. So only in this case would the BPJS staff members actually spend their work. Huh? Because I'm always impressed when I hear that BPJS has roughly 10,000 staff members, which is very, very little for 270 million people. So it cannot work. You cannot have 40 million people who are in active status call BPJS. There will be nobody to answer the phone. It is impossible. So I think this could be one way of making good use of the resources. So this would be artificial intelligence because it's speech recognition and really a decision of what to do. You want?
Baik, rekan-rekan, menarik ya kalau kita lihat bahwa bagaimana peran dari AI ini. Kalau tadi kita cerita tentang diagnostik dan treatment, so sekarang kita lebih melihat kembali bagaimana bisnis proses khususnya untuk social health insurance atau JKN yang kita punya, bahwa kalau lihat dari gambar yang disajikan Prof Jens ini ternyata bisa untuk meringankan beban kerja ya dengan jumlah staf tadi yang sangat-sangat terbatas untuk bisa melayani seluruh populasi masyarakat Indonesia. Bayangkan kalau yang komplain itu banyak. So maybe the examples like those who like frequent asking questions that are bisa otomatis terjawab selesai begitu ya, kita tanya kemudian terjawab selesai, tetapi ada hal-hal yang so there are only selected questions that goes to manual processing, that it will also be a way to reduce the workload for every staff. Jadi sangat bisa meringankan ini ya beban kerja. Mungkin ini juga bisa dilakukan di institusi lain selain BPJS. So it's not only can be applied in BPJS but also in other type of business process.
Absolutely.
Yeah.
And yes, you're right. This is very similar to frequently asked questions. And I told BPJS when I spoke with them, I would speak to the people in the call center. What are the most typical questions which you answer every hour? Every hour when you sit on the phone, what are the questions which you are being asked? The frequently asked questions. And then you can start training the chatbot on answering these frequently asked questions. Now, I know that you have many different regions here. Do you also people speak differently in Indonesia, like dialects? Yes, but like I know from Germany, the way people speak German from the north of Germany is very, very different from the south of Germany. So I always make fun because I grew up in the north, but I studied in the very, very south. And so I know both. But like my friend, he doesn't like to hear it. He's from the north and he doesn't know the language in the south. So there is one famous comedian. She's from the south of Germany. She's very, very funny. And I understand and I always laugh, but he doesn't laugh. He doesn't get the jokes. Now, the question is, do we have something similar? What does that mean for the chatbot of the health insurance? We have to make sure that the chatbot understands different ways of talking. It's not even different dialects. They both speak German. It could also be dialects. It could be different language. But it might simply be that, I don't know, maybe the people in Banda Aceh speak Bahasa differently from South Sulawesi. So then you have to train the chatbot in understanding these different ways to speak, which is quite a challenge. Next slide. Now, yes. Now this looks very similar, but it is actually a different process. Now imagine there's a paper document coming to BPJS. Ideally, There would be very few paper documents because people use an app maybe, or they use digital communication. But I assume that even in the future, there will be documents coming in. Now, what do you do with them? In a classical administration, you have people opening the letters and reading the letter and analyzing, oh, this is for Department A, this is for Department B, this is a complaint, this is a reimbursement. So they have to read the letter, and that's very, very time consuming. This is actually, again, something which you can do with an artificial intelligence system. And those systems are being used in Germany at the moment because we have too much paper in Germany. So they use these systems to sort the documents and to move them into the right direction to the right department. And then again, could be automatic business process, or here the same as we have seen before. Next slide. Now, this is actually a quite difficult slide, and maybe you remember this. I hope that I will have the chance to hold my presentation on business process management, because I sometimes do a module, a class on business process management and automation here for this course. And ideally, you would already have heard that. Now, this is here this is an excerpt from the table which I had before. So the health insurance has to document decisions. It has to follow the law. And that's what you normally do with something which we call business process automation. Business process automation is something totally different from artificial intelligence. That's very important to understand. It's like unequal. Because in business process automation, you program specific rules. You could say you program the rules for what is an inactive member. An inactive member has not paid the contribution for a certain time or something. So you have a specific rule, and you have like yes, no criteria, like in a law. And then you have a new case. Maybe you write to the health insurance because you want to change your status, or maybe you leave the university and you have a job, and then your insurance status changes or something, and then your individual case is checked against the rules, against the rules programmed into the system, and the IT system, the business process tool provides an answer, yes, this rule applies to you, or no, the rule does not apply. And then, ideally, you don't even write a text, but the IT system generates the answer, maybe a letter or a record in a document based on existing text blocks. There is no artificial intelligence involved in this. So there's a clear rule, and you check the rule. Artificial intelligence, like we said before, trained with a large body of cases, compares with new cases, probabilities, text created, like when you ask, I always wanted to do that, but I never did. What happens if you ask ChatGPT the same question again and again? Does the answer change? Sometimes could be. And so doesn't fit to implementing rules. I mean, you have a specific question. I am working now in this company. What is my premium? Maybe. And you cannot have an artificial intelligence system. On Monday, it gives you this answer. On Tuesday, it gives you another answer. But artificial intelligence does that. It gives you a different answer on Tuesday. So that's why artificial intelligence, normally you ask about the limits. So artificial intelligence is not the solution for business process automation, because it is a different logic. Now, there is one bridge between the two. So I don't want to exclude artificial intelligence totally from this topic of business process automation. And we call that explainable AI. Explainable AI means the artificial intelligence not only gives you the diagnosis, it also tells you why it gives you this diagnosis. So it gives an explanation. Just imagine, I don't want to go back in the presentation, but remember the eyes, or remember the skin. Maybe this is then transferred to a dermatologist. And so the dermatologist not only gets cancer, no cancer, but gets, this is the area of the picture which looks strange. And this is comparable to that kind of pattern. So the artificial intelligence justifies and explains its own answer. And that is now becoming the standard in the medical field, because it is simply not enough to just say yes or no, but it has to be put into context. And this could be the solution to this problem if the artificial intelligence here provides an answer maybe for your request and says, yes, your request is approved based on regulation ABC. You fulfill the following criteria. So it is sort of documented how the conclusion has been reached. So here we can use, this is more an idea, this is a concept. But I think we could use this topic of explainable AI to really use also artificial intelligence for the business processes. Anything to explain?
Found that one of our audience from online has questions. Could you help us with the question? Yeah. It's on the variation. Do you want to respond?
A very good question. If you could even frame the question a little bit more general in to what extent digitalization will close the divide or will increase the divide. I would say it depends on how you do it. There is a risk that digitalization will increase the divide. Like we talked when we met Professor Laksono, we talked about COVID-19 in Germany and the experiences of, in Germany, the schools were closed. Now, the more wealthy ones, the more wealthy family, for them it was no problem because there were enough digital devices for homeschooling. We had classes via Zoom. But what do you do if you have one notebook maybe in the family and you have one father working from home digital, one mother working from home digital, and 3 children who are supposed to go to school in Zoom? So in that case, we could see that the digital divide, the social status, had a direct impact, and it was increased by this digitalization of homeschooling and working from home. So there is a big risk that social status will actually, the ones with a higher status will then have more opportunities than the ones who do not have that. I think the task for a social health insurance is to be aware of that and make sure it does not happen. So specifically create programs which are easy to access. Now, I read in one of the papers at BPJS Kesehatan that actually the number of people who have smartphones in Indonesia is quite large. So if a smartphone is very, very common, then a simple application, which is easy to use, which has a good user interface, might actually be something which reduces the digital divide. So it can work both ways. So it's not that it will always go in the one direction or the other. If you do it badly, it will increase the differences, but it could also reduce them. Okay.
Questions on the, I think it's more or like on the human behavior. So even the technology is there, but then some of us maybe prefer to have face-to-face. Lebih senang bertemu, kemudian mungkin ada ikatan batin lain begitu ya dibandingkan dengan online atau mungkin antara bagaimana tidak bertemu begitu ya. Ini satu mungkin pengalaman unik juga ya dari teman-teman. Berapa lama online we have online course, and maybe it's a bit different when we have like offline course like this, and then I can see your face and then your reactions when so when we communicate. So I think it's what do you think? Is it the same like in Germany?
Yes, absolutely. And here it depends on what you want to clarify. Like if I have a very simple question, maybe I'm satisfied with a chatbot because then I don't have to wait in line. Because BPJS does not have so many staff members. So for the call center, I probably have to ask to wait. But for the chatbot, I don't have to wait. I get the answer to the simple question. Now, but maybe if I have a more complex question, I really want interaction. And then I am willing to wait so I can speak to a staff member. So the question is absolutely right, but it is okay. It is okay to have then some people who are happy to use the chatbot and some people who are happier with in quote unquote real person. Then you give both opportunities. It's not either or, it's really and. You combine the two. The human touch. Well, for example, you talked about teaching. I very much prefer teaching in a room because I get more feedback. I at least I have the perception to see if I reach you or if I do not reach you. With my own students, I will always get into a dialogue. I will ask questions. I will discuss with them, and I find that is much easier face to face. It's much more difficult to get this human touch in a Zoom conference. But sometimes the human touch is not needed. Sometimes if I just want to clarify something like a fact or how does it work or what do I need to do, sometimes I just don't need that human touch. Sometimes I just want to clarify something as efficiently as possible. And then it could be okay to say, just let me speak to the IT system and get this over with as quickly as possible. Well, maybe for making an appointment.
Saya jadi ingat waktu di Jerman. So I remember when I was in Germany that someone cannot go directly to the GP without any appointment. So unless you are in an emergency, you will go to the emergency unit. But for untuk kayak puskesmas atau klinik harus ada janjian dulu daftar begitu ya. Jadi kalau kita kan bisa datang sewaktu-waktu begitu ya. So if in Indonesia you can go whenever you want without any appointment first. So I think it can be the system can how maybe you have any experience in China maybe compared to Germany. How people can obey the rules if there is a rules, for instance, have to be registered online first before you can access the services.
Well, similar to the question before, I think there is not one solution for everybody. So even again, we're talking about social health insurance with a duty, an obligation to be accessible by everyone. And so you cannot say you can only use the services when you can use a smartphone. You always, maybe you have a strategy like digital first. But like for my parents are 80, 84. I told my parents, you do not use online banking because I know they cannot do that. They are not able to manage these different systems. My parents would not be able to use digital health records. I'm quite sure they cannot do that. So there always has to be options for people who are not able to use these systems. So you have to have both. Okay. And you can say you give information, you promote the digital way, you try to encourage that, like for the question here, you try to make people understand the purpose of this chatbot. Yeah. Yeah. But you should never force them and say this is the only way.
Yeah. And the next question is on the security.
Mm-hmm.
The security,
maybe
yes.
Move the question up.
So it's on the hackers.
Can you move You're
It's
here. Okay, sorry.
yeah, it's the already there. For the
This
hackups.
one.
Before, I think, sebelumnya, Mas. Yeah, so it's on the security of the AI system, because of the now we realize that the leak of the system, it can be leaking. So
Well, I will come a little bit later to the legal side. So maybe we wait for that question. Let's just park that question because I will talk about the regulations. Maybe we continue with the presentation and then we see if we have already answered the questions in the meantime. Okay, next one. So one thing which again, about the role of the health insurance in promoting artificial intelligence, create reimbursement. I will give an example about that from Germany in a moment. Work together with startup companies. There are a lot of collaborations between health insurances or hospitals working with startup companies to develop innovative systems. And we had the question, where does the data come from? Your question. This could also be data from a health insurance, could be data from a hospital system, could be data from a health insurance system. So the health insurance should also answer the question, do we already maybe have data which can be used for AI? Set standards and interact with the policymakers. I will talk to that about that in a moment. Next one, please. Because this actually relates also to the data security question. You actually need a legal framework for artificial intelligence. These, just like you have to ensure the safety of medicines, you have to ensure the safety of artificial intelligence in health. Just imagine you have a treatment program using virtual reality and people get harmed. They are more sick afterwards than they were before. Now, this cannot happen. So we need rules. We have very, very strict rules in Europe. Actually, the rules which here I have written down, they're actually not German rules, they're European rules. So we also have some German ones, but the general trend for us is that the legal framework is actually for all of Europe. So we just passed last year the Artificial Intelligence Act, and which is just coming into force now, which takes place over a longer time. That is not specific to to the healthcare sector, but it is about everything. It is about any kind of artificial intelligence system. You see here, we have different risk categories. Health systems are always high risk. So there are certain rules applying for that, for data protection, for data quality. Limited risk, I know it's difficult to see here. This is, for example, a chatbot. So here, limited risk, it says transparency obligation. So concerning the question which was asked, you would inform the person you are speaking to a chatbot. You are speaking to a digital assistant. Is that okay for you? Or should we transfer you to a quote unquote real person? So that would be transparency. We have lots and lots of regulation on data protection. So you have to have certain certificates, ISO certificates, to manage that data. Otherwise, you're simply not allowed to keep that data in your systems. Plus, we have already the medical devices regulation, which has lots and lots of rules on the quality management systems, which you need when you manufacture digital devices. So to answer the question which was asked, it is not one rule, but it is a whole set of rules, of data protection rules, of medical devices rules, which limit the risk. There will always be a risk. The risk is never zero, but if you balance the benefits against the risks, it is still okay. So, and the question, that's the reason why here I'm asking only questions. And I think these are the questions to clarify for Indonesia. And I think that the academic field, the universities, plus the health insurance, have to work with the policymakers to set a good standard, a good legal framework for artificial intelligence. quality standards, patient rights. You have to make sure, like, for example, the data which you're using, does the patient know that his or her data is being used to train in artificial intelligence? In Germany or in Europe, we would always say the patient has to know. The patient has to say yes, because you can only use data, like if you use an image which was used for diagnostics. You cannot use that system now for another purpose, like training in artificial intelligence. So the patient has to consent to that. US would be different. The US, America, they're much more open in using the data. We in Europe are much stricter for the patient rights. So what is the rule for Indonesia? Is it clear what you can use? Question mark. And also, what can an AI system not be used for? That is actually here social screening. Social screening program means, maybe you know from the movies, you have an IT system which predicts where crimes will be committed. Now, those kind of screening systems, that would be social screening, that is actually illegal, already illegal in Europe, all over Europe. Also, systems where you would just monitor digitally whole and analyze whole countries or whole squares and make videos from all the people and do facial recognition and see who is walking where. Those would be unacceptable risk. They're actually forbidden. So it has to be clear, what can you not do with artificial intelligence? Patients' right, data protection. So there need to be rules. And of course, there have to be agencies which ensure that these rules are actually followed, that they're implemented. Do you want to comment or shall I continue? Okay, next slide, please. Now, I will not go into this in detail because you can actually read this document in English. This is an example from Germany, and this is what we call prescription apps. Now, these apps are not necessarily artificial intelligence. It's digital medicine, or what we call digital therapeutics, which do not necessarily have to be. There can be artificial intelligence, and there will be more in the future, but sometimes it's just simple software. And the point here is that these are actually prescribed by a doctor. The physician gives a prescription. He could, maybe nowadays, he could prescribe either physiotherapy. If your back hurts, the doctor prescribes physiotherapy, or he prescribes a digital app for a home physiotherapy personalized training. So this would be an app which is then the patient gets the prescription, the sickness fund, which is our insurance, gives a code, and here the DIGA provider, that's the IT company, the company which develops the systems, is paid by the health insurance. So like the pharmacy gets reimbursed for the prescription, the IT company is reimbursed for the medical application, for the digital health application. And that has actually generated a lot of innovation. You can go to the next slide. Unfortunately, this is then only in German. This is the registry of these approved digital health therapeutics. And so far we have 58 applications can be prescribed through the normal health insurance systems, like any kind of physiotherapy or any kind of medicine. This year is actually for hypertension. There are a lot of programs for psychological issues like mild depressions. Normally, you would not go to a psychiatrist if you have a mild case of depression, but maybe it would be good to do so you don't develop a severe case of depression. So they can use the digital application like as a first line of treatment, so they prevent the need for second or third line of treatment. We have some programs. We talked with your colleague about smoking. So there are programs here. If you're dependent on nicotine, your it's a disease. Huh? So if you, it's like, yeah. And you can have a treatment, a course, which helps you to stop smoking. So these are digital programs. And the good thing is you can use many, many, many of them. Huh? You don't need a specialist then. And again, this is unfortunately only in German. There has to be evidence. So there have to be studies. There's a lot of information about how the intervention works, how it is reimbursed. Yeah, this is actually quite a good thing. Maybe next one. This is actually the last slide from my side. Here this is what I wrote for BPJS for the presentation. I think that what a large health insurance has to do, like BPJS, is actually have a small team of people who understand artificial intelligence, who can actually inform the management about how it can be used efficiently in the whole organization. There has to be an AI strategy, so it has to have clear priorities, even if this is something which will happen over the next years. So it does not have to be implemented tomorrow. But the colleague in the chat said that BPJS is already experimenting with chatbots. So what are the next steps? How do you roll that out? What is the framework to use that in? And especially a large insurance like BPJS should actually promote artificial intelligence in the health sector, like for screening, because everybody else is small. You have one hospital here, one hospital here. So if you want to make an agenda like for AI in screening, in disease prevention, I think it has to come from the health insurance, even if they don't do the system themselves, like a public health campaign to use digital and artificial intelligence programs. We talked about it before. There have to be reimbursement mechanisms. If you say we want to have more telemedicine, then there has to be a reimbursement way for telemedicine. Like I heard in Denmark, nowadays, telemedicine is always the standard. You always go to telemedicine first, and only after that you go to the GP. But that only works if you reimburse that. Identify pilot specific use cases for improving the efficiency of the health insurance. So should that be a chatbot, or should that be generation of document or decision support or verification of claims? So pilot that and try it out. It's something, these AI systems, these complex IT systems are very much learning by doing. You should not wait until the system is perfect and then do it, but you have to start with small scale, collect experiences, and then you will get better over the time. What data is there already in Indonesia? Again, your question for training the system. What data is there? Indonesia is so big. Indonesia is roughly 3.5 times as big as Germany. And Germany is the largest European country. Huh? So you are one of the very, very large countries in the world. You should be able to do this on your own. Denmark is too small. Huh? Maybe a few million people. Probably there are more people in Jakarta than in Denmark. So, but Indonesia is so big, you should have your own capacities, your own data based on the demographics, on the needs of the Indonesian population. So you should not be relying on data from other countries. Yes, maybe you can use it sometimes if it works and is available and saves resources. But generally speaking, this should be Indonesian data. You should be transparent towards the insurees about artificial intelligence. How do you use it? Where is it used? They should understand it. In Germany, we have also, for historical reasons, people are very, very critical about data protection. Sometimes too much worry about data protection and not see the use of the data. So I think that it is easier if people understand, at least have some basic understanding, what their rights are, how data is used. So that is something which the health insurance has to do. Who should do it if the health insurance does not? Somebody has to tell the policymakers what legal frameworks are needed. These are very, very difficult topics. You have to understand technology, plus you have to understand medicine. The people in parliament probably understand neither artificial intelligence nor medicine. So how shall they make, for this very, very difficult topic, how shall they make good laws? So the health insurance, as one player, has to tell them how to make the good laws. It's also important for the staff to know. BPJS Kesehatan has so few staff members in comparison to the number of insurees. Nobody will lose the job if they're all chatbots. There's so much work to do. They will need everybody they have. But still, sometimes people are afraid that they will lose their job, even if it is not the case. So there has to be a dialogue, an understanding also within the organization. Yeah, and to have the policy framework. I already talked about that. So this is something, and you can go to the last slide because that's actually my last one, and then I hand over to you. So the point here is, as I said in my very first slide, artificial intelligence is already there. It is not the future, it is the present. And it will develop over the next years. So the question is, where do you start? Oh, where do you set the priorities for Indonesia? And how do you make the health system in Indonesia more efficient, more effective, more accessible through artificial intelligence? Please.
Thank you, Prof. Jens. I think we still have time to discussions, especially for. So I will give for you in the room first, and then we will. Dan kemudian kita akan lihat pertanyaan-pertanyaan dari teman-teman online. Ya, silakan.
Terima kasih Budia. Prof. James, my name is Zikri from the healthcare management. I want to ask about the Actensio AI application in Germany. I mean, from your experience in Germany how long does it take for the piloting the Actensio until it can be implemented in Germany? And what are the main problem that Germany people face when they have to use the application in healthcare? Because in BPJS Kesehatan there's a Prolanis program. The Prolanis program is like a group disease specific models that in the regulation the healthcare facility should make a reminder for monthly visit to their participant, to their Prolanis participant. But in the implementation, I'm evaluating one of the primary healthcare in Yogyakarta region. They can implementing that reminder. Even from the WhatsApp application, they can't afford it. So it can be implemented very well for the monthly reminder. So can I ask you about that? Thank you.
Maybe can you open the presentation again, just the very last slide, because that will help a little bit to answer your question. By the way, you probably get the slides afterwards. You will send them. You will find my contact details and my LinkedIn profile on the last page. So if you want to. Now, to answer your question, there is, for the question was about time. How long does it take to set up a system? There is a huge difference between top left and bottom right. Because since top left is medical devices, the medical devices regulation applies. So it has to be safe, which means that the regulation process, I'm not talking about the development of the system. The system now, just imagine you have developed the system, it is there, and now you want to follow all the regulation and actually be able to use it. Like, you know, the scientific the trials which you have to do with medicines. You have first, second, third stage medical trials. Now the system is different from medical devices, but here I would say the time once the system is fully developed, and you cannot change anything anymore, then you do have to do studies with the system. You have to, like trials with a medicine, you have to do studies, you have to have documentation for the products which will be tested, which will be reviewed by independent bodies. So the whole approval process, if it goes really fast, will take 1 year. Probably it will be 1.5 or 2 years. So that is between you finish developing until you can actually use it with a patient. Now, and this always applies to artificial intelligence, because I showed you this risk pyramid, and risk and health in AI is always high risk by definition. Now, on the lower side, this is not artificial, this is artificial intelligence, but not medical device. So you will do a totally different approach in development. The IT people call it agile development. It basically means you start with something small, you see if it works, you build on experiences, and it's like in circles. You have like you develop something, you evaluate, you change, you evaluate again. So it gets better and better and better. So here, on anything on this lower side, you can generate a positive impact quite early. Like, for example, just imagine having a chatbot which is only good for answering the top 5 frequently asked questions. All the other questions it does not know, but still top 5. And then you have top 7, and then you maybe have top 10. So here you can have gradual improvement, and you don't have, like for the medical device, there is no risk of harming a person. That's why here you can be much, much faster. It's cheaper because the regulatory costs for the left side are very high. So that's why it's very important, this clear understanding. Are you dealing with a medical device, or are you dealing with something? And your example of reminder for monthly visit is clearly, in my view, is administrative. That's not a medical device. So honestly, I don't really see why that should be so difficult. You know what the difficulty is? Okay. It's very difficult to say something now, but it does not sound very convincing. Yes, okay, you will not get it for free. But probably one good programmer could do that. So you probably don't need a huge IT company for to do that, but probably one clever person. The one clever person will never help you with a medical device. And that's the point I'm making. You always need a big team and a company with medical specialists and et cetera, for a medical device. But that kind of thing, I don't know why it should be so difficult. We will not clarify here.
Okay.
I'm just saying
Okay.
that here I would assume that this flexible approach should actually work in developing a small solution, which maybe does not work for all use cases, but maybe for most of the simple ones, and then you gradually improve.
Yeah, how they utilize the application, for instance. So he mentioned about the system like disease management program in Germany. So we have Prolanis here. So how to stimulate patient to use or utilize the application. I think that's also another challenge, especially for the designer of the applications. So the application means to make it easier for the patient. So do you think that there have to be like evaluations on the application itself? Is it customer friendly enough, or so that the people can use it easier, or do they any organizational support, especially from the BPGS or other parties that involve as stakeholders, or are there the human that operate it, are they skillful enough to respond if there are any questions or that need to be followed up?
There are two-part answers to that question. And the first is for if we're talking about compliance, for example, for disease management, the first is the user has to see a need. So there has to be the feeling, I want to have better coordination. I want to have more information about managing my chronic disease. If they don't feel there is a problem, then they will not use the system. So user need is one aspect. And the second one, Ibu Dia, to answer your question, in Germany, or in Europe, we have what we call the medical devices regulation. And in this regulation, it specifically says that you have to involve the users. So you have to have usability tests. And actually you should do more. You should, as a developer, do more than what is written in the regulation. You should actually, the best practice nowadays is to have users in the team when you develop, because they know what the problem is. I know a group of people, it's like a self-help group for people who have chronic bowel inflammation. So they have chronic issues, which sometimes are very, very, which have a huge impact on your personal life. So they know what the problems are. And they said, we will develop an application. So then the chances of it being used are much better because it is you can call it user-centric development. So that is maybe the answer to your question.
So can we open the questions from our colleague online?
I think we had that. We had the risks.
Ya, di bawahnya. Ya, okay.
I think we have to distinguish a little bit what we're talking about. We'll first try to answer this question specifically related to artificial intelligence. Artificial intelligence is not so much about integrating the different IT systems. It's more to have the data set where you train. Like if you do the dermatology, you need the dermatology pictures with the diagnosis. And that is one set of documents. It is not integrated. You don't want to have it connected with all the other systems because of data protection, data security. So you don't want to have anybody messing in your training sets. So this will be stored somewhere in one secure server system, data center, and not be connected. So this is something different. The training of AI systems is something very, very different from the integration of a health information system. Now, there is a link between the two, which is the point of standardization of data. Like if the diagnosis is always written with the same terminology, then it will be easier to use for the artificial intelligence. And it will also be easier for the integration of the health information system of the country. Okay.
Okay. So what we need is to assure that the quality of data is good, so that like garbage in, garbage out. So I think it's yeah. Jadi kalau kita malah terbalik ya, punya data banyak.
Does everybody know what this term garbage in, garbage out means?
Yeah.
So if you have bad quality in your data set, you have bad quality in the result.
Kita terbalik ya, kadang-kadang data kita banyak sekali tetapi tidak digunakan secara optimal. So we have lots of data that compiled in it can be on the provider side or in BPJS, but the challenge is how we could use all this huge data for make life easier. Ya, jadi membuat hidup itu lebih mudah begitu ya, apalagi melakukan banyak pekerjaan. So most of all multitasking. So I think this will be very helpful, especially on how to use starting from automatizations to verify with yes or no at the beginning. Seperti melakukan verifikasi apakah satu pasien eligible or not, itu dari awal saya rasa sangat-sangat membantu ya untuk bisa mengurangi beban kerja begitu ya dari staff. Maybe one
more.
One more.
If there is one, or are we finished?
Selesai?
Is that the
Mungkin
last one?
ya, apakah ada dari rekan-rekan yang di ruangan ingin klarifikasi, mumpung ada Prof Jens, atau jika masih ada dari online yang ingin raise hand, dipersilahkan. Atau pengalaman, apakah mungkin teman-teman punya pengalaman juga bagaimana menggunakan tadi ya aplikasi-aplikasi yang sudah ada. Saya rasa banyak sekali ya aplikasi. So we have already application on screening, for instance. So it's a it's like questionnaire that we can fill in. But we have to scroll because it's too many questions. So I think ada yang pernah menggunakan data screening?
What kind of screening is it? What is screening
It's
for?
screening for diabetic, pre-diabetic, yeah, and hypertensions and other, that after you fill in the screening form, then there will be suggestions, or it's not a conclusion, but suggestions, whether you need to see the doctors, or you have to take some laboratory tests or something like that.
And that is already digital?
Yeah.
But I hear that it could be better. It could be more user-friendly.
Yeah. Yeah. So
and that is not so difficult.
Yeah.
Making something like that user-friendly in an app, which you can easily use, like you would use an app like WhatsApp and chatting, for example.
Ya, atau ada teman-teman yang pernah membuat seperti aplikasi untuk survei cepat atau
maybe just to take up your idea, Dia, what you very often see in these digital applications is that you use like processes, maybe like a screening process of forms, which was in paper before, which is already there, maybe in your disease management program or survey or questionnaires, and you turn these into applications. So the medical content is often already there and is then used in a digital way.
To transform from the paper into a paperless. Yeah. Masih.
All questions answered? Tired?
Sudah terjawab? Ya. Yeah, I think it's already 3 o'clock. Dan terima kasih sekali untuk partisipasi aktif dari teman-teman sekalian, dan Prof Jens Geissler also provide his contact email. So teman-teman bisa menghubungi beliau jika ada hal-hal yang ingin diklarifikasi lebih lanjut. Terima kasih teman-teman semua. Applause untuk Prof Jens Geissler. So thank you very much. So this is not the end of the session. We still have some more sessions, I think, in KPMAK. So terima kasih banyak teman-teman. Sampai bertemu kembali di sesi-sesi yang akan datang. Sampai jumpa. Wassalamualaikum warahmatullahi wabarakatuh. Selamat siang.
Terima kasih.
Thank you.
Thank you very much.